And that can also serve as a reminder to take that allergy medication. Many of us have been doing just that because it is another bad allergy season. Joining us now is allergy specialist Dr. Phil Hemmers with St. Vincent's Medical Center, here to explain. Doctor, welcome.
Thank you, Lisa.
So it seems like we hear that it is a bad allergy season every year. Are allergy seasons just getting worse?
That's exactly right. Our allergy seasons in Connecticut are worse year after year. We're having higher levels of pollen, which means more symptoms: runny nose, sneezing, itchy, watery eyes. Also, these symptoms are lasting longer. It's not just a spring problem. Things are going into the summer and through the fall.
All right, doctor, do we know why that is?
The best theory is global warming and climate change. The warmer temperatures, the higher levels of CO2 have resulted in more plants, and more plant biomass will lead to more pollen. So warmer temperatures is the most likely answer.
All right, so how does someone know if it's an allergy or the latest COVID variant when they're sick?
That's a great and very pertinent question. We've had lots of patients in this last week calling with symptoms that could be either runny nose, sneezing, those itchy, watery eyes. Everyone assumes allergy, but it could be COVID, especially if you have some non-allergy symptoms like fever, sore throat, body aches. I strongly urge patients not to assume that you're having allergies, to get the COVID test and make sure you're not infected or contagious.
All right, let's talk about mask wearing. Can it help with pollen? What are you hearing from patients?
Definitely. That was one of the unanticipated benefits, among the very few. We had patients last year coming in telling me how good they're able to be outside and they're not having their runny nose and their sneezing. There is a clear benefit. Unfortunately, it's not helping anyone with their red or itchy, watery eyes. We'd have to add goggles and a face mask for that.
Okay, and let's talk about, a lot of people say, I never had allergies until this year. Can you develop allergies as an adult?
You can. Allergies can start at any age. They're most common, kids, teenagers, that's when you first see it. But unfortunately, you can have allergies 30s, 40s, 50s, at any time they can start.
All right, real quick last question. What is the best treatment for allergies?
Best treatment is if you can avoid the thing that you're allergic to. With pollen, that's nearly impossible. So you're going to have to be taking over-the-counter medications, prescription medications, and if nothing is working, you should definitely see an allergist. We have something called desensitization, where we can help your immune system build a tolerance and help you to get rid of your allergies.
Excellent. All right, allergy specialist Dr. Phil Hemmers from St. Vincent's Medical Center with Hartford Healthcare. Thanks for joining us.
Oh,